Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Bloated stomach causes and treatments. Feeling bloated and heavy after eating is a common problem. Most of the time, a bloated stomach will get better on its own and is not a cause for worry. /r/n/r/n However, bloating that happens too frequently or never seems to go away can be a sign of an underlying problem, which may need diagnosis and treatment. Some ideas on how to debloat quickly and prevent bloating in the future are listed ahead. /r/n/r/n This article will examine some of the potential causes of a bloated stomach and how healthcare providers might diagnose and treat it. /r/n/r/n Verhart Getty Imagesrnrn When bloating becomes a problem, it's natural to look for something that can offer relief quickly. Some evidence-based tactics may help reduce bloating quickly and prevent it from happening again. /r/n/r/n Some of these include /r/n/r/n Making big changes to your diet and limiting certain types of food without the advice of a healthcare provider or registered dietitian can be harmful. Avoiding food groups could prevent you from getting enough vitamins and minerals. /r/n/r/n Getting help from a dietitian in order to safely understand how the food you eat is affecting symptoms and to help institute changes is important to avoid problems in the future. /r/n/r/n Bloating is when the abdomen feels full and swollen. It's a common issue that affects almost everyone on occasion. It often goes away without any special attention or treatment. However, it can be related to a chronic or acute digestive condition in some cases. /r/n/r/n Distention occurs when bloating becomes so pronounced that the belly sticks out. /r/n/r/n Common symptoms associated with bloating can include /r/n/r/n Most people experience bloating from time to time. The cause might be obvious, such as eating a big meal, or it could be more difficult to determine, such as when it is caused by certain medications. /r/n/r/n Bloating can develop from eating foods that cause gas. The digestive system produces gas as it breaks down foods. Some foods don't fully digest, but instead are broken down by the bacteria in the intestine and cause gas. Sugars, starches, and fiber, in particular, act in this way. /r/n/r/n Drinking carbonated beverages and drinking with a straw, which could lead to swallowing air, may also cause gas and lead to bloating. /r/n/r/n Sensitivity or intolerance to certain foods may lead to bloating. FODMAPs have been shown to cause bloating in some people. It can be challenging to understand which foods are causing the bloating, which may mean that the symptoms come and go. People who also have IBS may be especially sensitive to certain foods and experience bloating after meals. /r/n/r/n Some medications and supplements may cause bloating. Fiber supplements, in particular, may lead to bloating, which may get better over time as the body adjusts to the increased fiber in the digestive system. /r/n/r/n Medications and supplements that could cause symptoms of bloating include /r/n/r/n Bloating is common with premenstrual syndrome, PMS. It may be experienced each menstrual cycle or occasionally. Endometriosis, in which tissue resembling that of the uterine lining grows outside of the uterus, may also produce bloating as a symptom. /r/n/r/n Bloating could also be a longer-lasting problem. Certain conditions can lead to bloating that doesn't go away on its own. /r/n/r/n Bloating is not listed as being part of the criteria for diagnosing IBS. However, a significant number of people with IBS report it as being a problem that impacts their lives. The subtypes of IBS include diarrhea predominant, constipation predominant, and IBS with mixed bowel habits. Bloating doesn't appear to be associated with any particular form of IBS more than the others. /r/n/r/n once thought of as pseudoscience, SIBO is now a recognized condition. In SIBO, excess bacteria grow in the small intestine, with bloating as one of the symptoms. It can occur on its own or be connected to other conditions. It might also be associated with medications such as opioids and steroids. /r/n/r/n celiac disease occurs when the immune system reacts to gluten by attacking the lining of the small intestine. Foods that contain gluten include wheat, barley, and rye. Once thought of as rare or a condition of childhood, celiac disease is now known to affect people throughout their lifetime and cause many symptoms within the body. /r/n/r/n people may have a sensitivity or intolerance to gluten, which is different from celiac disease. This could cause bloating and sometimes diarrhea or constipation. A person with NCGS could have a reaction to gluten or certain types of sugars. It may be difficult to distinguish NCGS from a sensitivity to FODMAPs. /r/n/r/n gastroparesis and functional dyspepsia are both under the umbrella term of motility disorders, and bloating may occur in these disorders. /r/n/r/n functional dyspepsia may be diagnosed when symptoms affect the upper digestive system, but no obvious cause is found. Gastroparesis is when the stomach does not empty itself of food properly. Both conditions could lead to bloating and distention. /r/n/r/n bloating is common and not usually a cause for alarm unless it continues for long periods of time or is accompanied by other symptoms. Symptoms that are a cause for getting medical attention include /r/n/r/n bloating can be treated in various ways, depending on the cause. Prescription medications might be used to treat the cause of bloating. The medication used depends on the underlying cause and related conditions. These can include /r/n/r/n dietary changes might also be tried. In the case of celiac disease, a gluten-free diet is the only treatment. Gluten might also be avoided for those who have NCGS or a gluten intolerance. Avoiding FODMAPs can also help those who have IBS or other conditions that include intolerances to those foods. /r/n/r/n some types of mental health treatments, including cognitive behavior therapy and hypnotherapy, have been shown to help with IBS and chronic constipation. These methods might be used to address the symptoms of these conditions, including bloating. /r/n/r/n bloating can significantly impact quality of life. For those coping with painful bloating, it could affect their ability to carry out daily tasks at work, school, and home. /r/n/r/n when bloating and pain become significant, they could lead to seeking care from a healthcare provider or even the emergency department. This can be costly and lead to absences from work or school. /r/n/r/n not knowing when bloating may occur could also affect mental health. It could lead to less enjoyment of food and restricting food in an effort to reduce bloating. The time and energy spent trying to avoid symptoms or coping with them when they do occur can drain physical and mental energy. /r/n/r/n when bloating and pain or distension are chronic problems, a healthcare provider may give you a referral to a specialist called a gastroenterologist. Gastroenterologists have training in diseases and conditions of the digestive system. People experiencing bloating may also decide to ask for a referral when bloating becomes an ongoing problem. /r/n/r/n a gastroenterologist may start the examination process with a thorough history and a family history of digestive problems. Several different types of tests may be used to get more information on the cause of bloating. /r/n/r/n this could include /r/n/r/n for most people, bloating comes and goes, but it can become chronic for those with an underlying condition. Finding a cause and an effective way to treat it takes time, patience, and dedicated healthcare providers. /r/n/r/n keeping a food and symptom diary and including details about meals, such as where they were eaten or any emotions, can be helpful in tracking down triggers. A healthcare provider can offer suggestions on how to manage diet to help avoid possible triggers. /r/n/r/n Getting a referral to a gastroenterologist is another key part of learning more about what could be causing bloating. Digestive specialists have a variety of guidelines and tests available to understand the underlying cause and treat it. /r/n/r/n Bloating is a common problem that may resolve on its own and usually does. Over-the-counter treatments and dietary changes often are the initial steps in managing bloating. /r/n/r/n However, bloating can become a recurrent problem when an underlying condition causes it. To get a diagnosis and treatment, you can work with a team of healthcare providers, including a dietitian, a gastroenterologist, and a mental health specialist. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.